of Maine's Department of Corrections. Commissioner Liberty and I are here today to provide everyone an update on the COVID-19 situation across the state of Maine for today, Monday, June 29th, 2020. We begin today's briefing on a sad note. Maine CDC is reporting the passing of another individual with COVID-19. She was a woman in her 60s from Kennebec County, and her passing marks the 105th death of an individual in Maine with COVID-19. We offer her family our deepest condolences during this time of their grief and hardship. Overall, Maine CDC is reporting 3,221 cases of COVID-19 across the state, an increase of 30 cases since yesterday. Of those cases, 2,861 are confirmed and 360 are probable. Right now in Maine, there are 31 individuals currently in the hospital with COVID-19, 8 of whom are in the ICU and 4 of whom are on ventilators. Statewide, 2,593 individuals have recovered, an increase of 16 since yesterday, and 803 of our cases have been among healthcare workers. I'd like to provide an update on one new outbreak that Maine CDC just opened and an update on a pending outbreak that we've been working on. Just recently, Maine CDC opened an outbreak investigation at Bath Iron Works. Maine CDC is aware of 3 cases associated with that facility. 2 of the individuals work in the same department, and all 3 carpool together. All 3 also spent time inside the facility until approximately June 18th or June 19th. In addition, our initial investigation indicates that these 3 individuals participated in outdoor union-related activities as well. Maine CDC has been in close communication with Bath Iron Works. We had a meeting that just wrapped up about 30 minutes ago to discuss arranging for testing of potentially exposed individuals, as well as other responses to these 3 cases. As always, the safety of affected individuals is our top priority. Our investigation is just now getting underway today, and we will keep everyone updated as our investigation proceeds. I'd also like to provide a quick update on an outbreak that we talked about last week, which is the outbreak at the Sedgewood Commons facility. We've been working with that facility as well, and they are planning another round of universal testing there. All the affected patients were largely on one unit. And in addition, the facility has moved patients from other units who may have been exposed or who may have tested positive to this single cohorted unit. There too, our investigation is underway, and as we learn more, we'll make sure we provide updates to everyone. I'd like to turn next to an update on our public health emergency preparedness activities. The first is that just over the weekend, Maine CDC was made aware of another shipment that would be coming to our state from the federal government of remdesivir. As we understand it, there will be 5 additional cases of remdesivir arriving today across the state. As we always do, as soon as Maine CDC receives those, we will in turn ship them out to hospitals statewide. I'll have more to report on that on Wednesday once we know that the remdesivir shipments have arrived and that they've reached their final destination. I'd also like to provide a quick update on the work that the National Guard is continuing to do to fit test healthcare workers across the state. Just today alone, June 29th, our colleagues at the Guard are undertaking a fit testing mission that will result in nearly 130 healthcare workers across the state being fit tested and thus being able to use N95 masks at their work site, at their workplace, so that they too can keep coming up to work and keeping Maine people healthy. Cumulatively, the National Guard so far has tested over 2,700 individuals to make sure that they can take advantage of N95 masks. That represents nearly 100 missions to date. As they always have, they still have about 600 individuals in the queue waiting for their fit testing. Finally, I'd like to provide a quick update on something we haven't talked about in a while, but I think bears an update. And that is our continuing effort to distribute PPE across the state. As of yesterday, Maine CDC has filled nearly 2,400 orders of PPE, 2,400 orders since we began our activation. This represents 1.7 million pieces of PPE that Maine CDC has distributed to healthcare facilities, frontline EMS, fire and rescue individuals, as well as to hospitals across the state since we began our activation. We too show no signs of slowing down and are intending to continue distributing PPE during this difficult time. And finally, a quick update on the vital medical assets that Maine CDC tracks. Overall, there remain 401 ICU beds in the state, 162 of which are available. There are 319 conventional ventilators, 260 of which are available for use, and there are 441 alternative ventilators. Before I turn things over to our colleagues in the media for questions, one quick note on the testing data. The servers that we use to manage the intake of testing data have been slowing down lately. Part of that, a large part of that, is because of the increased number of tests that are being reported. Folks who have seen some of the data that we've put out may have noticed a significant uptick in the number of tests that are being completed across the state of Maine on a daily basis. A week ago, it was in the low 1,000s. Now we're squarely above 2,000 tests per day. This is surely a good sign. But virtually all of those tests is reported to Maine CDC, and usually in electronic form. Because of the increased volume of test reports that have come in through our electronic reporting system, our servers have had, of late, a little bit of a difficult time running all of the calculations overnight. So I don't today have the latest data on testing. I hope to have it very soon. And when we do, we will update our website, and I'll make sure I also post it on social media as well. But the reason we don't have that is our website, and I'll make sure I also post it on social media as well. But the reason we don't have that is, thankfully, because there's been such an increase in the amount of testing done, we're working to shore up and steal our own servers to make sure that they can keep up with the calculations of data as they come in every night. So with that, Commissioner Liberty and I will be glad to take questions from our colleagues in the media. And the first question today goes to Emily Tadlock at WABI.
Hi, Dr. Shah. Okay, so I actually have three quick questions, and they're all kind of related to outbreaks, possible outbreaks, possible cases that we've seen and heard about from different places. The first one, we've learned from EMMC Northern Light Hospital that several patients and staff may have been exposed to a person who later tested positive for COVID-19, and that person was, according to officials at the hospital, asymptomatic. And we've been told the person is a traveling doctor. Is the CDC aware of this? And if so, what can you tell us about it?
Sure. So we've been working with EMMC on this situation. Right now, as with many of these outbreaks, our investigation is underway. Thankfully, we have worked with EMMC since day one of the COVID-19 epidemic. And so we've worked with them on the exact protocols that they're now putting into place to identify potentially exposed patients and staff, and then make sure that those patients and staff get notified in a quick manner and then can be offered testing appropriately as well. So again, we'll have more information on that as our investigation gets underway.
Okay, and then the next one is we've been told about one patient testing positive at Orono Commons. How are you guys aware of this one? And if so, is universal testing taking place, that sort of thing?
So Emily, you are correct. We too have been notified of one individual at Orono Commons. Per Maine CDC protocol, we have recommended universal testing of all staff as well as all residents at that facility. And we understand that the facility is undertaking that as we speak.
Okay, and the last one is a kitchen staffer for the Milo Summer Meals program has also tested positive. We've been told that others have been alerted, but I know there are probably a lot of concerned parents. So what are the chances that this could have passed to kids or parents that are also involved in the summer meals program?
Sure. Based on what we know scientifically about the transmission of COVID-19, the likelihood of transmitting it through food is very, very low. Certainly, if there were any individuals who were in close proximity with this individual, say in the back of the house in the kitchen, that's who we would want to focus our efforts on in terms of testing. But the exposure to any particular child or parent via something like a common object or food is very, very low.
Great, thank you.
You bet. We're going to turn next to Patrick Whittle at the Associated Press.
Thank you very much. I needed a moment to unmute. I'm typically towards the end, which I thought maybe had something to do with the alphabet, maybe. But anyway, there are Maine is continuing to trend in the same direction, but a lot of the states that send tourists to Maine are experiencing some resurgences right now, and I'm curious what that means for the reopening calculus here, because obviously summer is here and tourism is a big part of that, and I'm just curious if that could affect any of our timeline.
Yeah, Patrick, we are of course focused on the data, not just in Maine, but in other states as well. We're always taking a global look. And there are a couple of trends that have emerged in the past 4 or 5 days. One, of course, are the significant upticks in cases in the southern and western part of the United States, as well as in the Northeast, a relative amount of stasis in the number of cases. Again, that's just in the Northeast. Now, it's important to note that that can change really, really quickly. But we're trying to take both of those factors into account as we're thinking about any types of amendments to the way in which we've constructed quarantine and testing requirements. We're looking at a number of other approaches that other states have put into effect. They've all got benefits and drawbacks. Right now, one of the things that I'm thinking about is an approach that further allows us to quantify the relative safety of individuals who may be coming from other states as they think about traveling to Maine. And the two variables that I'm taking the closest look at right now is the correlation between the number of cases per million in the population, as well as the positivity rate. And looking at the correlation between those to see if it tells us anything about the relative safety of individuals who might be coming into the state. Both of those are, of course, markers for the prevalence of the disease, which is, when it comes to thinking about travelers to Maine, fundamentally what we care about. So we're taking those things into account, as are all the other states. This is a situation, as everyone can imagine, where there are multiple different approaches and they all have their strengths and weaknesses. We're trying to craft a solution that helps us think about not just New Hampshire and Vermont, but other states as well as we get further into the summer. I expect to have more updates on that over the next coming days. I'm going to turn next to Maria Sacchetti from the Washington Post. Maria? All right, we'll come back to Maria in just a moment. And in the meantime, turn to Megan from WMTW.
Thank you for taking my question. My question is related to daycare facilities. We've been made aware of a daycare facility in Sanford that has had 2 employees as of now test positive for COVID. One, I would want to know if the CDC has been made aware of that. And 2, let's say, for example, you are a parent with a child in one of the daycare facilities, or this particular one. We had heard from a parent that they went to their doctor and said, I have a 1-year-old, I want the 1-year-old tested. And they say, we don't do that. So I'm curious, is there any kind of guidance about pediatric testing for COVID and COVID-19? And would you wait for your child to be symptomatic, or can you do it if and when they are pre-symptomatic?
Sure thing. So Megan, the data around children being affected for COVID-19 are still being developed by scientists. But based on what we know right now, it appears that children, if they are infected by COVID-19, have a lower severity of illness than do adults. At the same time, what's not well characterized is the extent to which children could potentially pass on the disease to, say, elderly grandparents. There is really detailed guidance on the on the US CDC website on appropriate testing protocols for children, when they should be tested, what type of mechanism they should be tested with, what kind of swab, things of that nature. And that guidance is updated frequently. In addition, the American Association of Pediatricians separately has guidance that dovetails quite well with the US CDC's guidance. That's what we follow here in the state. Now, right now, we are aware of the situation at the daycare facility that you noted. We've been working with them. It has not yet reached an outbreak threshold, but we have been working with them nonetheless because of the heightened sensitivity around these situations. What I would recommend to any particular parent who might have a child that attended that daycare facility is first and foremost, check in with your own pediatrician. This is a situation where your pediatrician will know your child best and know whether your child has other health conditions that might make testing for COVID-19 warranted, or on the other side, maybe perhaps your child is otherwise healthy and in the opinion of your pediatrician, testing is not warranted at this time unless or until the child becomes symptomatic. That's fundamentally a decision that's made by the pediatrician working with the parents of the child, because each and every case is different. So our recommendation right now is for parents to check in with their family doctor or pediatrician. They'll be the person in the best position to give particularized advice. I'm going to turn next to Bob Evans at News Center.
Good afternoon, Dr. Shah, Commissioner Liberty. First question is for Dr. Shah, and I have a follow-up question. Dr. Shah, how is the CDC working with the Department of Corrections to conduct universal testing at the Long Creek Correctional Facility? And when would you expect those results might be known?
Sure thing. So, Bob, let me start almost back at the beginning. When the first evidence around how COVID-19 transmitted became known back in February, maybe even late January, one of the first groups that we sat down with was Commissioner Liberty and his senior team, because of the concerns and the possibility that COVID-19 could spread through correctional facilities quite quickly, as has occurred in other states. One of the things that we put into place was, with Commissioner Liberty and his team, an approach to make sure that individuals got tested, not just if they were showing symptoms, but the entire facility. We've put that plan into action now on separate occasions, first at the Maine Correctional Center, now at the other facility in Long Creek. The way that we, Maine CDC, operationalize that is on a couple of different ways. The first is that we are able to provide the sample collection kits, the swabs and the transport media that Commissioner Liberty's team needs in order to take the swabs themselves. We're also standing by to provide technical assistance if there are questions about how someone could be tested or whether they need to be exempted or anything of that nature from a scientific perspective. And then, of course, the third thing that we do in assistance is we run the samples themselves at our laboratory in Augusta. Those samples are being collected and results are typically available within about 24 hours. They're usually collected in waves and results are usually followed about 24 hours after the waves arrive. Commissioner Liberty can describe more about their protocol that's underway.
Sure. I'd just like to say that the staff and the leadership teams at all the facilities have done a fantastic job in the planning and preparation in combating COVID-19. On Saturday, we did in fact receive a positive test indicator for a youth that had been released from Long Creek. It is now our practice to not only test individuals that arrive at Long Creek, but also as they depart, so we can make an informed entry into the community. The individual is asymptomatic, and as Dr. Shah said, at that time we began universal testing. And so we're about 80% done with that testing now. All of the youth that are in our care have been tested, and most of the staff have been tested. And I'd like to praise the hard work and dedication of my leadership team and those individuals that are doing tremendous work down at Long Creek as of this weekend.
And I have a follow-up question for Commissioner Liberty. Previously, I believe you said that you wouldn't be doing testing of inmates at all of the correctional facilities in Maine. Is that still your opinion, and why not do so?
If you're talking about universal testing all of the time, I think it's important to remember that we have nearly 2,000 offenders in our care and 1,100 staff. That'd be 3,000 tests. I believe that we follow the recommendations of Dr. Shah and the Maine CDC and the National CDC in doing testing when someone's symptomatic, when they arrive at a correctional facility, when they transfer from one facility to the next, and when they exit the facility entering the community. And we feel as though that's provided a safe environment for both our staff and for our offenders.
Thanks for your question, Bob. We're going to turn next to Liz Graves at the Ellsworth American.
Good afternoon, Dr. Shah. Thank you. A question about guidance for employers and business owners. I know that's sort of a DECD question, but it's on the health side. DECD guidance asks employers to notify staff who come into contact with an ill person of their possible exposure to COVID, whether from a coworker or a member of the public. But there's some parts of the state where availability of testing is still very limited, so there's some confusion about what to do in the absence of test results or while waiting for test results. So I've heard from a business owner today that he got a phone call Saturday evening from a regular customer with whom he had had lunch outside a few feet away a few days earlier. The customer had some symptoms, was able to get a test about an hour away, but it'll be 5 days before he gets results. So this business owner is a little stumped about what to say to himself about testing himself and employees and how to proceed.
Sure. So I can't provide any specific advice in the situation that you outlined without knowing all the facts. So what I can say in general is that any individual who has come into close contact, say having lunch, with someone who is later found out to be someone who is positive for COVID-19, that individual should be tested. There's little question about that. During the time period in which that test result is coming back, the best thing to do for anyone who may have been exposed is to limit the likelihood that they may expose others. So that may involve staying home from work, or in any case, their business. That may involve making sure they introduce some separation with family members at home. It's possible that the individual, the first case, may come back negative, of course. But in the meantime, while that is being undertaken, introducing as much physical distance from coworkers, employees, family members is the safest way to reduce the likelihood that that individual could transmit it to others. If that individual starts showing any symptoms whatsoever, then getting tested is certainly indicated. Now, you may be wondering, why not just go ahead and get tested? Well, there are a couple of reasons. The first is that it can take a little bit of time after someone has been exposed to the virus before the virus has reproduced enough inside the body for it to be detected. And so it's not just a question of whether to get tested, but when to get tested as well. If this individual had quick, easy access to rapid testing, that may be different. But as you noted, in certain parts of the state, access to testing differs. Now, in terms of what to convey to, say, employees, the safest thing there, again, is to be upfront. If someone may have been exposed to someone who later turns out to have COVID-19, employees should be notified, and that individual should stay away from the workplace as long as possible so that they can minimize the likelihood of any transmission. I want to emphasize here, I'm not providing specific advice. That is just what the US CDC guidelines say in any situation. Of course, the details matter, and so this is just generally what the guidelines say.
Thank you. This was one of the instances that helped clarify for me the discussion we've been having around the standing order for testing, because the standing order does not require providers to provide a test if the healthcare provider doesn't think a test is indicated. Correct?
So the standing order permits it permits a healthcare provider to provide a test, even if that person, another healthcare provider doesn't feel it's necessary, or their primary care provider doesn't feel it's necessary. So the standing order is not a requirement that somebody necessarily must get tested. It's an option for somebody who may not have a primary care doctor to allow them to get tested more easily. But it doesn't obligate any healthcare facility to necessarily offer or provide testing to somebody.
Wonderful. Thank you very much.
You bet. I'm going to turn next to Kevin Miller from the Press Herald.
Great, thank you. First, a question for Commissioner Liberty. Can you just tell us a little bit more about how many residents there are at Long Creek right now, and how many staff members you have? Just want to get a better sense for how many tests are being done.
I'm on mute. We're all on mute. Commissioner, you're on mute, sir.
Okay, we have 35 offenders that are at Long Creek. We have 187 staff that are employed there.
Okay, and you said all of the 35 offenders have been tested by this point, right? And then the 187 staff, that's the remaining that you're waiting for?
Correct. That's correct.
And there's no update as far as have you had come back with any other positives other than the first individual?
That's correct. No tests have been returned to us.
Okay. Great. And is there any other steps that are being taken in the meantime? You know, are you trying to keep the offenders separate from each other, or any other kind of protective steps that are being taken?
That's correct. So we're already we have a heightened practice of hygiene. The offenders are being medically monitored now, and they're separated from other individuals. All of the staff are wearing PPE, as are the youth, as we have been. And so we're doing all the precautions we can do to keep the residents safe until we receive our tests, which will guide our future actions.
Great, thanks. And Dr. Shah, a quick question for you as well.
Sure, good. Go ahead, Kevin.
So the BIW said there are three cases now. Can you tell me what more is being done? Are you not proposing, or are you proposing universal testing at this point of BIW? Because that would be a pretty big undertaking with such a large staff. Or kind of how are things going about there?
So Kevin, we discussed that with our colleagues at BIW. As you note, they have upwards of 6,600, 6,700 staff. Of course, the facility there is quite large. So our approach right now is to look at it on an exposure basis. So we're looking at the situation along two axes. The first is kind of department by department. And then the second is recognizing and looking at offering testing on a department by department basis. But we also, based on our call this morning, understand that individuals interact with each other, even though they may be from separate departments. So the other thing that BIW has already started doing is doing their own internal contact tracing. They've actually developed lists of exposed individuals based on the nature of the facility and things like key card access at different places. It's been easier for them to verify who may have been in proximity to the three individual cases. And we've been able to generate that internal contact tracing list. And that's who we're primarily focused on right now. So the first wave of testing will be offered to those individuals from that internal contact tracing list. And then we'll take a look at that and then zoom back out and see if we need to offer testing on a more department by department basis.
Do you have numbers for how many people are be included in that initial group?
Yep, it is. In total, 53 individuals from that internal contact tracing list.
Great. And then just one last quick question. Have you been in contact with the union as well, since you mentioned that some of these individuals have been active in the union activities?
I know that BIW has. One of the items on my call list as soon as we're wrapped up here is to reach out to the union as well. That will be done by within the next 45 minutes or so. I know that BIW has, but I wanted to touch base with them as a Maine CDC matter as well.
Great, thank you.
Mm-hmm. We're going to turn to Caitlin Andrews from the BDN.
Dr. Shah, I have two questions. One, well, actually, Kevin just kind of answered my BIW question. So my question is actually for Commissioner Liberty. I was hoping you could kind of explain about the youth who is tested positive. If you could talk a little bit more about how long they were at the facility and just kind of give us a sense of the testing policy. How early do you test children before they are released, and how do you time that so that you can kind of get a result before they are released?
Sure. So the youth that was released and has a positive test is a 16-year-old female, and she was with us in our care for 21 days. We typically will always test as they arrive, and then we try to test them prior to them leaving in a time fashion. But given the nature of the detention of some of these youth, the judiciary may release them prior to that time, and so there are times when we get a test, we don't get the results back before their departure into the community.
Can you talk about when you tested them and how long that difference was between when you tested and when you got the results and when they were released?
Yeah, the following day after her release, we received the results of the test.
And I'm sorry, when did you test her?
She was tested the day before she was released.
Okay, thank you.
Thanks, Caitlin. We're going to turn to Dustin from New England Cable News.
Hi, Dr. Shah. I'm pulling up my question here. I've drafted it out. So you talked about the aids in testing, and I know you touched on this a little bit when you talked about who should get a test and when. We saw some of these images of crowded streets at night in Portland over the weekend. If somebody was in a crowd that they perceived to be large, should they go get a COVID-19 test because they're more available now if they're worried? And how does somebody make that determination? Because we know in Massachusetts, other places where there were protests or other crowds, the governor said anyone who was in these crowds should go get a test. So what's your message to those folks?
So I've got a couple of messages, Dustin. Should those individuals get tested? Let's start with can they? Not long ago, actually about a month ago now, Maine CDC issued a standing order. We've talked about it just a couple of minutes ago here. And that standing order specifically has an allowance in it so that people who have been participating in any type of large congregate outdoor activity who feel that they may have been exposed and would like to get tested are explicitly, by its terms, covered by the standing order. So that answers the can they get tested? And under the standing order, the answer to that is yes. A related question is, will they be able to find a healthcare provider who is able to test them? Again, just because you've got the standing order doesn't mean that every single healthcare institution in the state of Maine has the capacity to offer the testing. So our recommendation there is to go online. Maine is participating in a national website that lists COVID-19 testing site availability. I think it's called Get COVID-19 Testing or something of that nature, and certainly Google could find it. We have been taking pains to make sure that we touch base with testing sites in Maine and keep the Maine-specific updates of that website up to date as much as possible. So then there's the question, Dustin, of whether they should get tested. That's a harder one. What we know is that statewide, the highest rates of COVID-19 are in Cumberland County. And so anyone who was in that gathering, which, I saw the same pictures as you, perhaps, and I noticed that folks were quite close together. So I would recommend that anyone who was in as part of that gathering do get tested to make sure that they can use the standing order and to call the testing site before they go to avoid the possibility of potentially infecting others. Dustin, your question raises a bigger point, though, which is something I want to just drive home today. the fact that we are moving toward reopening is not the same as returning to normal. Reopening is not the same as returning to normal. Although many types of venues are moving toward reopening, the pandemic is still with us. The virus is still among us, and we're not out of it yet. Far from it, in fact. And so I do ask everybody, even as we are all resuming social and economic activity, to do the things that we've talked about during these meetings for time immemorial. Chief among them right now is wearing a face covering, especially if you're going to be in a crowded outdoor setting, let alone an indoor setting. That advice applies equally no matter who you are and what age group you're in. I think it's important to note that the average age of cases in Maine has come down since the beginning of the epidemic. The median has gone from over 50 to now under 50, which means that half of the cases of in people in Maine are underneath the age of 47, below that age. So not only is the outbreak still very much with us, it's starting to affect younger and younger individuals as we all collectively are resuming economic and social activity. So this reopening is not to be taken as a resumption of normal. The virus is still here, and I ask everyone to take precautions to not only keep themselves safe, but everybody in their community too. I'm going to turn now to Amy Brown at WERU.
Thank you, Dr. Shah. We're hearing reports too of people who, sorry, I don't know where that feedback's coming from, not here, but we're hearing from people who are feeling like they're getting the runaround, getting tested, even if they have symptoms. It does seem to be a bunch of different standards for different providers. And also the Maine CDC, as you said, has removed some of the barriers that other places still have in effect. So how does one go about getting tested through the Maine CDC? And that website that you just mentioned, I just did a quick search and didn't find it, but I did find a US CDC website that sounds similar. Is what you're referring to, the Get COVID-19 Testing website? Is that the US CDC site?
So a couple of notes there, Amy. It is not affiliated with the US CDC. It's another outfit that's been tracking in rather granular detail the types of testing sites that are available. We've heard those concerns. We've also heard from a large number of individuals who have successfully gotten tested, even though they may be or may have been completely asymptomatic. Drugstores across the state are, for example, now offering drive-through self-swab testing availability using the Maine CDC standing order. But as you noted, Amy, and as we've talked about, healthcare systems may, for different reasons, have a different approach to offering or utilizing testing. We recommend that folks do a couple of things. The first is call before you go. Make sure that you've touched base with the testing site to make sure that they will, in fact, test you when you arrive. The second is if the testing site tells you that, for example, you need to have a copy of the standing order, make sure before you go, you've got that so you can utilize it. But we're also hoping that as the availability of testing, specifically the supplies that are needed to do it, expands across the state, more and more providers will be able to offer testing. This is a concern that's been raised not just in Maine, but across the country. The standing order removes a significant hurdle for that. Before the standing order, perhaps the largest complaint that we heard week after week, day after day, was that individuals who may not have had a primary care doctor, or individuals who, for example, may have been as part of a large gathering, could not get testing because they didn't have a doctor or didn't have a doctor who was willing to sign off on it. The standing order removes most of those barriers, though not all. The next barrier is to make sure that testing sites across the state can offer the test itself. We're working to expand that even more and keep options up to date for folks.
It sounds like the CDC processes the tests faster than some other places do. Which tests are you all dealing with? What's the pipeline to get them done, run through the CDC?
The test that anyone should be looking for, irrespective of what kind of testing site you're going to, is the PCR test. not the antibody tests. There are some indications for antibody testing, but for members of the general public right now, the PCR test is the one that they should be looking for. In fact, our standing order only covers the PCR test, not the antibody test. We've heard differing reports on the turnaround time. We heard from a woman directly who was able to take her daughter to a drugstore in Augusta and get a test result back within 24 hours. We've also heard from others who have said that when they've gone to get tested using the standing order, the lab that the healthcare facility sends those tests to may have taken 2 or 3 days. So it is a mixed bag out there. All the more reason to call and touch base before you go.
And just finally, can you give an update on the situation in Castine, including how many of the people from that out-of-state party have tested positive?
So based on where we are in Castine right now, we are aware of a number of individuals. I'll have to check and get the latest. I believe it was 7 individuals from out of state who had been in Maine for a short period of time and then returned to their home states and gotten tested positive back in their home states. We have touched base with the health departments of those states to learn about what they've seen. We've also been made aware of a single individual who is himself an out-of-state resident, but spends time in Castine, who has also tested positive. We're working with that. We've already worked with that individual to see if they had any other exposures to anybody in the Castine area. My team had a call with the town manager earlier today and touched base with them to make sure that we were aware of the latest on the ground, and also talked about other matters, and specifically making sure that anyone who may have been exposed has been touched base with, so we know what's going on.
So test results are still pending?
I'm not sure if there are any test results pending. We'd have to, individuals in the area may have gone to their healthcare provider to get tested. We wouldn't have insight into whether those are pending until whatever lab they sent them to returns the results to us.
Thank you.
Mm-hmm. And the final question for today goes to Ed Morin of Maine Public.
Yes, thanks so much. You've mentioned a couple of times today the delay in some cases for getting COVID-19 tests back. We've heard that some walk-in COVID-19 test facilities say they've been so inundated by tourists seeking tests to comply with the governor's guidance that that may at least be a contributing factor in the slowdown, that some people may have to wait 5 days to get the results back. Wondering what the state has heard about this and what can be done, if anything, to expedite the situation.
Sure, Ed. So that's certainly a possibility. We haven't heard from any of the testing sites directly on that. It would be something of a surprise, I will say, because many of the testing sites utilize large multi-state laboratories like LabCorp or Quest, facilities that are churning out hundreds of thousands of tests per day nationwide. So it would be interesting if that uptick were driving that to the degree that you mentioned. If they were going from 1 or 2 days as a turnaround time to 5 or 6 days, one wonders whether there are other factors at play that might be going in other states as well. Nationwide, testing has increased. Even within Maine, testing has increased as well. So there's a lot of factors at play right now. What we are working on continually is to try to stand up the swab and send sites that we've talked about. These would be sites that would be at different places across the state to offer individuals, no matter where they're from and no matter what their reason for testing is, the opportunity to be tested and have those tests run at the Maine CDC laboratory. Our turnaround time at the Maine CDC laboratory remains about a day. So we're hoping that as we can utilize the Maine CDC laboratory in that fashion via these swab and send sites, we'll be able to offer even more expanded testing across the state. That was the last question. I wanted to close with 2 items. The first is just a recap on the testing front. And the website that I mentioned, that I just wanted to make sure I read out for everyone, is gettestedcovid.org. gettestedcovid19.org. Again, that's gettestedcovid19.org. No hyphens, no underscores in that URL, just one word, gettestedcovid19.org. That's the website that we've been working with to try to keep updated all the information of testing sites across the state. With that, Commissioner Liberty, is there anything further on your end?
Yes, I'd just like to say that the Maine Department of Corrections has been working exhaustively in the planning and preparation. The effort's been led by Dr. Ryan Thornell, the superintendents, the directors, the wardens, and our partners, WellPath. And it's been an honor working with Dr. Shah, giving us the guidance, the technical assistance to prepare. We're very ready. We're trained. We have the equipment, and public safety and the safety of our clients is our most concern. Thank you, Dr. Shah.
Thank you, Commissioner. We've very much appreciated your willingness to partner with us since the earliest days of our preparation. So with that, I thank all of our colleagues in the media for joining today. And as always, I thank each and every one of you for tuning in. I hope everyone has a good afternoon. Please be kind and take care of one another. We'll talk again on Wednesday.